In this fourth episode of the COVID Diaries, brought to you by the Talking Transformation podcast team, we headed west to New York City in the United States of America, to Hong Kong in the east, and up in Europe in Romania, checking in with Carli Venter in Bucharest, with Eloise Rosseau in Hong Kong, and introducing Flavio Copolla, who is living there in New York City. We hear what has changed in the week, and the week is a long time, certainly when looking at and considering the COVID-19 virus. We hear from Hong Kong what has changed and shifted within the last 3 to 4 days. We hear from Carli as they head towards phase 4 in Bucharest. And we hear from the epicenter of the virus in North America, courtesy of Flavio in New York City. In this episode, we talk about issues of trust, of e-governance, of real-time tracking, what is possible in spatial terms to track virus hotspots, and we also look at the theme of density, much beloved concept of built environment professionals, town planners, urban designers and the like. This is clearly one of the issues that's going to come into sharp focus on the back of the COVID-19 virus. Question of density, appropriate densities, how will these conversations look post-COVID-19? How will we discuss density? How will we discuss the advantages of urban environments when we're seeing the biggest concentration of the outbreak in our cities and our urban centres? There are no easy answers, but there is at least a conversation, and that's what we try and bring you on the Talking Transformation podcast. We hope you enjoy this episode. So it's a Sunday afternoon, and it's day 3 of the lockdown in South Africa. This podcast, part of the Talking Transformation podcast series, being recorded to you from Cape Town. But on the line, in and around the world, we have Carli Venter, who we spoke to last week in Bucharest, Romania. Carli, how are you keeping?
Hi, Pete. Good, I think. Living in a coronavirus-free bubble in my apartment and looking at the beautiful spring weather outside.
Fantastic. So you're safe and embedded there. That's good news. Across in Hong Kong, we spoke to Eloise earlier in the week. Eloise, how are you keeping in Hong Kong and how are things changing there?
Hi, Pete. I'm well, monitoring the developing situation in Hong Kong, but under circumstances, still healthy and happy.
Well, that's fantastic news, and I'm really, really glad to hear that, Eloise. And then across the Atlantic, all the way over in the Big Apple in New York City, we welcome Flavio Copolla. Thank you so much for waking up with your coffee there in New York City and talking to us here on the Talking Transformation podcast. How are you today?
Hi, Pete. Thank you for having me. I'm doing pretty well, drinking my tea, looking at the magnolia outside my kitchen window in Brooklyn, so enjoying a bit of nature from afar.
Fantastic. A New Yorker who enjoys his cup of tea. Sounds like an Englishman gone wrong. Are you sure you're in the right city there, Flavio?
No, I spend too much time in the UK. It sort of messed up my standards.
Good man. I'm actually going to start with you, Eloise, because we spoke earlier in the week. I think it was Tuesday or Wednesday, and things seem to have moved very quickly. We had talked in that opening discussion with you about how Hong Kong had learnt a number of lessons from the SARS outbreak in the early 2000s and was responding quite well. We knew there were people coming back from study leave and from elsewhere in the world. So returning Hong Kongers who were bringing back with them a degree of infections. But it seems that things have escalated quite quickly there in Hong Kong. What's your take on it at the moment?
Yes, Pete, since we last spoke, Hong Kong's case load has increased to 641. I think this is still quite a modest number compared to some of the other cities and countries we're watching around the world. But on Friday, we had 65 new cases confirmed, which is the single biggest daily increase we've seen in Hong Kong since the first case was reported in the end of January. So since Friday, we've had daily increases in that range of high 50s and low 60s. And last time we spoke, I mentioned that the majority of those cases are related to returning students or people with a travel history. While the schools and the universities have been closed in Hong Kong since the end of January, the government did introduce some new regulations over the weekend. So we've now banned any public gatherings of more than 4 people. Gyms, cinemas, other places of entertainment have been forced to close for the next 2 weeks. and all the restaurants are operating at half capacity. So a lot of people are working from home currently, but that's still not a government requirement for the private sector. It's left up to individual businesses to decide how they want to respond. But a lot of businesses following the example of the public sector, where their non-essential workers have been working from home intermittently since the end of January, returning back to work at some point in March, and now again working from home.
So that's demonstrating again the speed and change of this thing, I guess. You're saying early in the week, no lockdown, well, pretty much business as usual, with a sort of sensibility that we've seen before with face masks and people sort of observing when they're sick, using face masks and so forth. But now, as you say, if I heard you right, no more than 4 people can gather at a time, and some of the infrastructure, like the luxury items like cinemas and so forth, gyms, etc., closing down.
Yes, I think in Hong Kong it's still very much a developing situation. So while earlier in the month there was a sense of we've managed to flatten the curve, there's now a realization that these daily increases are quite significant compared to the tempo of increase in cases Hong Kong's seen earlier. But the city is still operating, public transport is still functioning, albeit that the streets look a little bit quieter than usual.
If we go north now to Romania, Carli, when we spoke to you, things seemed to be in hand, but there was definitely a change up in some of the, what you described as the Easter travel, particularly from Italy, which we know has been so badly hit. You mentioned that during the course of the episode last week. Have you seen any increase on the back of more, let's call it migration? Are people being able to travel from Italy? My understanding was that that country had now been pretty much closed down, borders closed down. Have you seen any change in the last week since we spoke to you?
Basically, at the moment, it's very difficult to get in and out of Romania. Most flights are, there's no flights out. And in fact, the country this week stopped all flights to and from Germany and France, which are now the 2 hotspots, sort of, in addition to Spain and Italy, I guess, in Europe. I think the Italians that were going to come, the Romanians based in Italy that were going to come home, basically came home a couple of weeks ago when the crisis started. At the moment, it's very difficult. The language is very much in the media. People shouldn't travel for Easter. And I think that message is starting to hit home now, that it will be very difficult. In any case, if anyone wanted to travel, they would have to travel by road. There has been some queues at border posts, but it seems to be under control. Easter also here, remember, is Orthodox Easter. So it's only by around the 17th of April is Easter weekend. So there's a little bit of time still yet to get there. But I think pretty much it will be a quiet Easter here. Just in terms of cases, when we wrapped up last week, we were at 430 odd cases. Today we're at 1,760. So a significant rise as well here. I've sort of been looking a little bit at South Africa's trajectory and Romania's trajectory. You know, in Romania, we had our first case on the 26th of February. In South Africa, it was on the 5th of March. And South Africa has now basically almost caught up in terms of numbers, although we had almost that decent week head start here. Conditions are interesting. I spoke in the last chat about these phases that government had set out at the outset. Our phase 4, which is like our worst case, is when we hit 2,000 cases. So we're really close to that. Government has been very vocal in the media about what that means. So, for example, at the moment, they have specialist facilities that have something like 2,000 beds that's reserved for COVID cases. They've really separated the COVID cases from other cases, from normal hospitals. What will happen is when we, probably in the next few days, as we hit the 2,000 mark, they put another 36 medical facilities into the system to deal with the crisis. And that gives us something like 8,000 extra beds. So government has been really great at managing this, preparing as we go through the phases, and we'll probably trigger phase 4 soon. What that means is also that they will start treating milder cases at home. So then starting to encourage people, if you have mild mild symptoms, please don't come to hospital, let us know and we can monitor you at home. So you can see how we progress from trying to keep everyone in hospital and separated and isolated to saying, okay, now we can't keep everyone separate anymore. So we need to manage people where they live and keep them in isolation and quarantine where they live. So that will probably happen in this week.
Thanks for that feedback, Carli. So what you're also saying is at the moment your hospitals are managing, they are coping at this stage. The upspike in the numbers there is again what we've become accustomed to with this disease.
Yeah, this idea of exponential increase, it's a good lesson in mathematics, I guess, is to just look at these numbers and see what exponential increases mean. Just also in the country, I think it's happening everywhere. We talk about a number for Italy or a number for South Africa, but they tend to be hotspots. So in Romania, there's an area called Suceava where they've had a really big issue in the hospital. They took in some of the first COVID cases and they don't seem to have followed protocols appropriately. So they basically ended up having all the nursing staff and all the doctors get infected. I think it's 80 or 100 medical staff. And the government actually had to close the hospital, take those medical staff to other hospitals to get treated. They disinfected the entire hospital and they're now reopening it as a COVID-only hospital and restaffing with medical people from elsewhere. So one small area really hit hard. And I think sometimes we also get a bit lost in the big numbers for countries, and there are always hotspots and some places where it's much, much worse and other places where it's relatively under control.
Important lessons to be learned there, Carli. I think what you're describing, as you say, the protocols and making sure that the centres that are being used to assist don't become hotspots in themselves. So thanks for that. Thanks for the feedback, Carli. Moving on and moving across to the Atlantic, and really where our focus of the discussion for the rest of today's conversation. We're heading to New York. Flavio, you've introduced yourself, but maybe before we get stuck into New York's response and where the city is at right now, maybe tell us a bit about your journey. What brought you to New York City, the role that you're playing? And we understand you work for the C40 program. Perhaps maybe a bit of an overview of what C40 is doing and how you're trying to coordinate in amongst COVID and so forth, responses on a more global network. So welcome again, Flavio.
Thanks, Pete. I moved to New York with my partner 3 months ago from the Bay Area in California, so the San Francisco Bay Area, where we had been living for about 6 years. But I'm originally from Europe. I'm Italian and French. So, my family has been impacted by the COVID-19 pandemic earlier on than we have here in the US. So I've been following this for a bit of time. In terms of what brought me to New York, I actually was recruited when working at C40 to work in New York, and then I ended up delaying it for various reasons and asking to work remotely, as we have an office in New York, but we do not have an office in California. I finally, made the move that had been expected for about 2 years, which has been great initially, as I was able to go to the office and, spend time with colleagues physically. Just briefly on C40. So C40 cities were a network of 96 cities across the world who are trying to tackle climate change by reducing their emissions and increasing their resilience. And we're really working with the largest and the most ambitious cities out there. So a mix of mega cities and a few cities that are small but very innovative in this place of climate actions, such as Copenhagen or Rotterdam, for example. But the general idea is that we work with mayors, we help them, follow through on commitments regarding reduction of carbon emissions and increased resilience. We support their staff technically, and we just make sure that the lessons that they have to teach to the world and to other cities are spread out and people have access to them. So what I focus on specifically, I'm an urban planner, and I understand that's the case of everyone, if not almost everyone on here. What I look at is what are some of the lessons in sustainable urban planning, sustainable urban development, land use that cities can learn from one another on. This infrastructure, this sort of virtual infrastructure of networks of city officials who know each other, who have been working with one another, teaching one another. Right now, with the COVID-19 pandemic, we are trying to use it to support our cities where they're at. And right now, in a lot of departments and a lot of urban planning departments across the world, the priority is not on processing permitting, but rather on adapting to this new reality of staff working from home, community participation no longer occurring in person, and also in some cases staff being redirected towards emergency relief efforts, depending on where the city is at. So we're trying to make sure that right now we're still sort of working with the cities on what is their number one priority at this time. So we're this is an ever changing and like very fast evolving situation and field right now. So we're just trying to catch up and make sure that we put the networks that we have at the disposal of people who are now figuring things out in their cities as we are on a personal level. So I hope that answers your question.
Certainly sounds like you've got a big role to play in terms of that coordination and the networking and really trying to link different administrations across the world to try and help each other out in what they're facing here.
That's sort of the idea. Yeah. We try to be helpful in every way we can. And the relationships that were built over the years amongst the different city officials that I've been working with and my colleagues have been working with are really valuable, not just to boost morale, seeing that others in other cities are also dealing with the same thing as this is going on globally, but also very concretely to sort out things like what should be, what's the typical size of testing tents that you should plan for if you're going to be setting some up in some unused parking lot, things like that are very, very specific, but that right now people need to know as they're facing the crisis.
Yeah, I mean, this thing about the criteria and the needs, whether it's spatial needs, whether it's the infrastructure needs for each of these different pieces of, let's call it infrastructure, quarantine sites, testing sites, they all come with a particular requirement and particular needs, I guess, and that sharing of knowledge is absolutely fundamental.
Yeah, particularly as I mentioned, cities are at different stages of dealing with this. So, we're looking towards our colleagues in cities that have dealt with this successfully. I'm thinking particularly of cities like Seoul or Singapore. Obviously there was a management of the epidemic in the early stages that makes sure that the numbers are not as overwhelming as they have been elsewhere. But there's also just work on the ground in the departments in terms of mitigation that I think everyone can learn from. So that's the ambition right now. And, we're still keeping our eye on our climate targets, obviously, but there, we have to work with what is going on right now. And I think it's for a lot of our city officials, this has been obviously incredibly disruptive. So we're meeting them where they're at and we're doing our part.
Maybe before we talk a bit about how each of those administrations is trying to deal with this, whether it's through e-government or other platforms, let's start with where your headspace is right now, Flavio, and the New York's predicament that it finds itself in. Certainly when you look at a map of the infections in the United States of America, it's absolutely overwhelming to see the concentration there in New York. It's clearly a major issue and has become more so week by week. So where's your headspace? What's your thinking? What's your observations of where both New York as a city, county, and ultimately the country as a whole is dealing with this issue?
I am quite concerned. I think watching things unfold in northern Italy and in other parts of Europe, I'm thinking particularly of Spain, over the last few weeks has made me realize how this needed to be taken very seriously and strong action was needed in order to contain the virus. And what has happened in New York is that action has been taken incrementally. Well, one thing to be noted as well is that we are talking about a complex, layered administrative situation in New York where if you're talking about the New York metro area, you're looking at New York City, composed of its different boroughs. You're looking at the authority that New York State has on those areas as well, which is different. You're looking at two other states at least. If you're just counting New Jersey and Connecticut, and municipal areas within those states. So, and in addition to that, obviously actions that can be taken at the federal level, which has authority for different things. So it just makes for a situation where there isn't just one lever of government that controls everything that, all the actions that would need to be taken in order to contain the situation. This really requires a coordination that's both horizontal and vertical, which is extremely challenging. So yes, I mean we're now facing a situation where New York is the epicenter in the I was just checking the numbers. We have about 30,000 cases right now, over 500 deaths. The thing to note, though, is that we are under testing in the US in general, although New York has been testing more than other places, has been testing more than California, for example. So there's a worry, for example, in California that we are underestimating the number of people that are actually affected. The number of cases is growing exponentially, as others have noted. This is just the trajectory of the virus when the containment isn't working as well. The other thing to note, and I think that's one that relates to U.S. political culture and tradition, is that there's very big reluctance to seal off any part of the United States from the rest. So allowing interstate travel is considered, a pretty essential right, which I think is the reason why, even though the idea of sealing off, maybe New York State, Connecticut, and New Jersey from the rest of the country, which was floated on Twitter by the president yesterday, was met with a lot of pushback and eventually not taken as a measure. And we'll see if that will actually go there. But my hunch is that that's going to be very difficult to do politically, even though that's been done in other places. I think Americans are really refractory to that idea.
No, I can understand, the land of hope and freedom of movement and all of that comes with that. Yet it is really becoming to the point where urgent measures, urgent times are needed to address these issues. The one thing that I've been very impressed by in terms of the public addresses that I've seen is Cuomo, is it? The state governor, is that correct?
State governor, for New York.
What's impressed me has been his sort of to-the-point presentation, fact-based, very, very sort of seems to get the gravity of the situation, and also seems to realise the overwhelming odds that he's facing. Any observations from your side on his leadership in this period?
Yeah, I think it's been helpful to have Governor Cuomo, go on TV every day and do his briefings and provide us with a sense of fact-based action. I can't really comment on the effectiveness of some of the measures that are taken. I think time will tell, but I think it certainly has helped the population in general feel like this is being managed, and we're seeing measures being taken slowly. Again, I think it's important to note that things were done incrementally here. It started getting encouraged to work from home if possible, which we did as an organization like really earlier on. And then the theaters on Broadway closed, and then some museums closed, and slowly all museums closed, et cetera, et cetera. Then we were told not to congregate over a certain number of people. Then the number diminished again. Then restaurants had to operate at half capacity, and then had to close altogether and only provide takeout, and bars closed as well. But this took place over a few weeks. I mean, maybe it was less than that. It's just that time has been stretching for me over the last couple of weeks, so it feels like longer. But I think the incrementalism of the measures has made it so that it has been a bit difficult to predict what to expect for a lot of people. One example is the fact that a lot of private hospitals in New York were not letting women who were giving birth have someone with them, be it their partner, their doula, or friend. And that policy had to be reversed by the state government just yesterday, I think. But there was no visibility as to whether that would happen or not. So I think it's a moment of uncertainty, and the incremental measures I think are also challenging in that respect, because it's hard for people to project themselves in exactly what's going to happen, how long it's going to take. And also it's likely less effective for them to take effect and get more stringent with time rather than being aggressive at first and just lasting a short amount of time.
I've been thinking quite a bit on my end about this whole idea of e-government, something that I've just been noting in almost all of the city examples, and maybe Flavio can sort of tag onto this if he's seen any of that in their network. But I've just noted, the first push for local governments seemed to have been to get their own workforce to work from home. Just spoke to some colleagues here this week, and they said, things they could never do before, like check their work emails on their personal devices. So suddenly the government has to change the policy and change a rule and help them all to set up their emails on their personal devices, and now they can work from home because they were not able to obviously provide everyone with a work laptop. I've also, that's sort of one bucket of things, is moving their own workforce to work from home. And then the second piece is then more using online platforms for things like, and I think in our world, things like building plan submissions, et cetera, government applications. You'll see a lot of apps being developed. I've seen a few examples of social services, sort of crowdsourcing social services, which isn't necessarily directly government, but communities coming together and saying we want to. I think one example I heard about this week was in Tel Aviv, where they had a government supported app for people to ask for social assistance, elderly people, et cetera. And they saw before the crisis something like minor, like 10 requests a week for assistance through this volunteer app. And they've ramped up to hundreds of requests literally in the last week. And so they were fortunate they had the technology in place, and they're now able to deploy it. So that's sort of my second thing is this moving towards delivering government services. And then thirdly, something I saw in South Africa recently on Twitter, one of the local governments back home sending out a notification that people's bills, their service bills, will be late this month because all the printers are closed and they cannot have their bills printed and posted. And so you should expect your bill for April to only arrive like the 21st or the 22nd of the month. And I'm thinking a little bit about how it's a simple solution to move to emailing people's bills, and it's been available for this municipality for a long time, but obviously there's a lot of people that's not made that move, so that could be a push to move people to the online system. But the impact of that on municipal finances, and it's not the right time to think about it now as we're still in the middle of the crisis, but just something like you not being able to send out bills because printers are closed certainly must impact on the revenue collection abilities of municipalities, and as soon as in the next month possibly. So I was just things that has sort of come up on my radar in terms of local government in the last little while.
Yeah, I mean, Flavio, this is something that when we talked earlier in the week started to come up. And I mean, what is it that you're seeing with that network of, sorry, you'll need to remind me how many cities that you're dealing with. But how does this whole concept of e-governance and so forth start to come into the conversations that you're having, and particularly in response to the COVID-19 epidemic?
Yeah, and just to link it to Carli's point about municipal finance, I think that that interaction is pretty crucial. We're seeing in some cities that rely heavily on permitting fees to fund the departments. It is absolutely critical to be able to keep those things going online in order to keep a steady stream of revenue into the department. So, I think that switching to online-based tools and also being able to have staff working remotely when necessary is something that local governments have been struggling with for a while. Some of them dealing with it pretty effectively, others less so, as it's a pretty cumbersome thing to shift the entire administration to remote working and to permitting online, for example. But I think we're seeing that in many cases where staff are simply not able to come into work anymore. They're asked to stay home, but they still need to deliver on a lot of their work. Then we're seeing cities scrambling to figure out how to both set up remote working systems and also set up permitting systems that work, that are online. So I know that's been the case in Curitiba in Brazil, where they've decided to switch to digitalized applications after doing paper applications up to now. So I think they're sort of adapting to the change as we speak. It certainly doesn't, go without its challenges. So that's where I'm really keen to learn from cities like Cape Town, which have been digitalizing their processes earlier on in order to make sure applications can happen online, for others to learn quickly on how this can get done. This is a bit of a moot point if the construction has stopped entirely, right? Like, you would still be able to process a few applications, but you just wouldn't be getting that steady flow. So, but we obviously have to imagine that this isn't going to last forever. And as some standards get relaxed, even if the construction industry is stalled right now, it would start again. And in that case, we would want the government functions that support it to be ready to roll.
No, absolutely, Flavio. I think there will be life after this crisis. There will be an economy, even if it's trying to reboot, even from a recession. And many of our economies will be in that space come the end of, I assume, this calendar year, if not before. And the whole question of how you get the economy going in a construction way, and the development process and system supporting that, is going to be fundamental. So the speed that each of those administrations is able to address that, I guess, will be absolutely fundamental to a 2021 calendar year that has at least an upturn in it somewhere along the line.
Yeah, Peter, I've really been amazed at many of the largest cities. I think I mentioned this yesterday already in the last call, that, a lot of them are forward looking about what does this recovery look like? What do we have to get in place? I think it's, as you mentioned, that certainly and Flavio also mentioned, the number of applications for certain things are just going to be down now. But also then thinking a little bit about the role of local governments and municipalities in the social services that they deliver to people. I think we probably haven't spent enough time thinking yet about all the additional social impacts that might come down the line, and for which local governments really are very well positioned as the front line of government to deliver those services to people. And I think for all the talk about nations and national governments, and that in this kind of crisis, of course, national governments, you need the machinery of national government to do stuff. I think local governments as the people-facing part of government certainly is going to be very important going forward, as a conduit for government support, but then also in just supporting their local communities to get through this.
Eloise, maybe any lessons from the Hong Kong side, particularly around the engagement between the administration, Hong Kong government, and sort of trust issues, and how you can actually influence and be supported by and supportive of the communities. Any lessons that you have witnessed through the Hong Kong experience?
Sure, Pete. My experience has been that the Hong Kong government has been quite good at communicating with their citizens. But I think in terms of any government having their citizens rate their performance, you almost have to take a step back and contextualize where the relationship between citizens and government is at. So as I mentioned previously in our last discussion, prior to the COVID outbreak in Hong Kong, that challenge was preceded by almost 6 months of political unrest. So in Hong Kong, there was definitely a level of distrust between citizens and the government. And early on, the government also received quite a lot of criticism around whether the border between Hong Kong and China should be shut. So I think it's extremely important in situations like this, especially where you're dependent on citizens changing their behavior, to establish a level of trust between the government and the citizens, and to try and manage the sources from where people are consuming their information, to make sure that that information is coming from trustworthy sources. And I think it's been a little bit of a challenge for the Hong Kong government in the political climate that we find ourselves here. But despite that, my personal impression has been that they've been quite good at communicating information.
Thanks for sharing that, Eloise. Much appreciated. I just wanted to ask the question, Flavio, in the whole question of real-time data tracking, the ability to track hotspots within different cities, hotspots of this virus, hotspots of people and patients, or people who've been diagnosed with the disease. Is this something that you're seeing in the conversations that is helping the administrations to target in spatial terms their resourcing? Or is this something that we're not actually having enough conversations about based on your engagements these last few weeks and few months?
Thanks for the question, Pete. So the disclaimer is that I am not a public health specialist, so I might be totally off base here. My understanding is that being able to map out hotspots is helpful if you're at an early stage of an epidemic in a given city, because you're able to isolate perhaps more effectively cases as opposed to having widespread community spread across the city. I know this is something that was done in Seoul in terms of mapping out precisely where cases were occurring so that people can check whether they had been at that place and time, and potentially got in contact or interacted with someone who was affected. And I know that was also the approach taken in Montreal, and that's possibly the case in other Canadian cities as well. And Canada generally has been managing this quite well, where you would see on a government website something like a suspected or a confirmed case at this train station between this time and this time. Meaning if you went through that train station at the time on that given day, you should probably self-isolate for 2 weeks, or you should just make sure that you're not developing symptoms. And I think that's a really helpful approach when you have good data and you have people who are also trusting of the government. And we're going back to that topic, which I think is essential. And unfortunately, in the US, because we are in such a partisan political environment right now, it is hard for people on either side to trust one another on communicating scientific information and taking policy action that's appropriate. So no, the other things that we're seeing in terms of tracking data is something that's being done in Rio de Janeiro, which is looking at cell phone data to figure out whether people are moving as much as before, whether people are congregating. But I still need to discuss with our contact there as to how they're using this data, because I think there's always going to be a concern about privacy and about how does this data get used. And I think that's something that we're going to see come up increasingly, obviously, as we are in a situation that requires strong government action. There's always going to be justified worries about, whether it's too much power in the hands of governments and what happens once the crisis has passed. So I think this is something that we're all going to have to keep an eye on.
Flavio, we've seen New York and other cities in America respond in times of crisis, and the ability to bounce back. Resilience certainly applies to New York City, no doubt about that. But do you get a sense that this may be a game changer for New York in terms of, a lot of the conversation, it would appear just in discussions with colleagues and yourself during the course of the week, the question of density. As planners, we often talk about, density is the way to go. We want to see higher densities. And, there's Eloise in Hong Kong, there's yourself in New York City, two of the densest cities in the world. And certainly New York is struggling right now. Hong Kong to a lesser degree, but it has its challenges. Do you think we're going to see a change in, and this is an open question for all of us, is what happens post-COVID in terms of the questions of density and urban living? I suspect it's about to become a lot harder a sell. And are there any thoughts about where we're going in terms of that debate in the future?
So I'm really keen to hear from others on this, but I will just say this is a topic that I'm very concerned about for obvious reasons. I am seeing the conversation framed in New York, in the US more generally, as the reason why things are so bad in New York is because it is the densest city in the US, which is true if you only look at New York City, but not true if you look at the metropolitan area. Los Angeles is denser as a metropolitan area than the New York metropolitan area is. I think we as planners are going to have to, particularly those who work in matters related to sustainability, where density really is key to reduce transportation-related emissions. We're going to have to keep a cool head. We're going to have to come, with the facts, ready to explain how actually suburban living does not protect you from a pandemic. Actually, you have better access to public services and public infrastructure if you're in a denser environment. And also, it all comes down to early management of the crisis, really. Of course, community transmission is going to be easier if mechanically people are closer together. But density is not the cause for a pandemic at all, as we can see, like in the cases of incredibly dense Asian cities that have been managing this incredibly well, and be it Seoul or Hong Kong or Taipei. I think this is still in development. It's one of the things that's keeping me up at night in terms of what happens post crisis. And I just think this is something that we're going to have to contend with, as we've always been contending with the fact that a lot of people prefer driving their cars and having that type of living rather than a walkable environment where they can cycle that's generally healthier for them and provides better outcomes across the board. So I think this is just going to be one element that we'll have to add to the list in order to dispel people's concerns about this.
Pete, I can maybe add, I think I've also heard this argument of certainly that in denser areas, the better access to public services. So you would have, if you were living out in the suburbs, you have to get in your car to get to a shop. You have to, hospitals are far away. So there's the positive argument for density. I think there's something about what density means in high income places where, yes, people live on top of each other, but tends to be private space, so everyone has an apartment. But density, certainly in lower income areas, in thinking of Africa, that's now starting to deal with the crisis, looks very different from density as we see in higher income areas. And I think that's something that we will probably see, certainly in the next couple of weeks, people really grapple with. And then just lastly, I think the stuff that I've seen a lot online is this argument about streets as space, and that many sort of Canadian examples as well, where cities have completely closed streets for vehicles, and people are then able to use more than just the sidewalk, but actually the street as the space to get their exercise while at the appropriate social distances. So I do think also this idea of mobility and how we use the space, things like streets, are going to probably change quite a bit in the next as we come out of this.
Eloise, anything just from your side, from a Hong Kong perspective? You've gone from a Cape Town, in many parts of suburban Cape Town, very low density, to extreme high density there in Hong Kong. Any thoughts or observations in your time about this whole question of density and where it works and the threat to that on the back of this outbreak?
Pete, I definitely share Carli's view that when you talk about density, it's important to distinguish whether you're talking about density in the formal realm or in the informal realm. And I think density that might be considered problematic in the informal realm is obviously not going to be an issue in the formal realm. Likewise, I think in the more formal setting of high density cities, yes, when you live in a dense environment, it is quite easy in a situation like this to still access services. In Hong Kong, for example, if the metro were to be closed tomorrow, I'm still within walking distance of a hospital, within walking distance of a shop. I can access anything within walking distance. So I think it's extremely important in the broader narrative of trying to promote responsible densification in our cities to not throw the baby out with the bathwater and to blame density. I think it's interesting in the case of Hong Kong, often when they talk about the history of regulatory development here, they refer to these 5 different phases. And in fact, the first phase was about using building control to improve the public health. So planning regulations actually are very closely linked to public health. It's in many cases where it originated, trying to separate distances between buildings for improved sunlight, improved ventilation. So I think even though none of us are public health experts, planning definitely has a contribution to make when we think about how we build our cities going forward. And in the higher density cities, maybe not so much about de-densifying, but about having systems in place where when certain components of our high density cities shut down, for instance, the public transport, to what extent are citizens still able to go about their daily lives and access the services that they need?
I think those are all very, very useful points that you're making there, Eloise, and thank you so much for sharing that with us. So, colleagues, I think this is where we start to wrap up the conversation. And as always, I want to thank all three of you for taking time out from your various self-isolations across the world and spending time chatting to us, reflecting on some of the best practices, some of the emerging thinking. And I really want to wish all the three of you the very, very best. Flavio, in particular, thanks for joining us for the first time. It's been a real privilege to have you talking to us and reflecting on the experience of New York. We're watching from afar and holding our fingers and thumbs for you guys, and really hoping that you find an appropriate response, an urban response, that at least gets you through this in the quickest period of time possible.
Thanks so much for having me, Pete. Glad to be on this. It's great to be able to have this sort of conversation at this time.
Carli, you look after yourself up there in Romania. Keep the sun shining. Keep yourself safe, and hopefully those numbers continue to just get manageable. You're moving into phase 4 there. The next upscaling, hopefully an important period for both Bucharest and the country as a whole.
Thanks, Pete. It's an important week for us here. So I'll do my best to stay safe.
And Eloise, from your side, you have another week still left of self-isolation before you guys are able to start taking on the streets, but in no more than groups of 4.
Correct. 7 days.
And counting.
Yes. But I think no complaints this side. Many people are facing much longer periods in isolation. So we're also sending our best wishes to everyone out there that are in difficult situations.
Thanks for that, Eloise. On that note, many thanks again, colleagues. A safe week. Check in with you again in the coming days and coming weeks. Be safe and look after yourself. Thanks for your time today. We hope you enjoyed this episode of the Talking Transformation podcast. Please engage with us and let us know your thoughts on this episode. You can do so via the Anchor podcast platform. There's a voice message function available via the app. You can also follow us on Twitter via Talking Transfo and the number 1. So Talking Transfo 1. Our theme music is kindly made available by Tribal Need. Find out about the music, the street art shows here in Cape Town and Europe via tribalneed.com.